Our program is much like a family in terms of how much we support one another. We're in constant communication with one another, and really we come together as a team to see how we can best support these students. So bouncing ideas off of one another, being the supportive person for one another, reaching out for resources that one social worker may have and the other one doesn't. That constant communication and collaboration is going to be applied to the interns as well. We're going to wrap our arms around them and really make sure that they get an awesome experience and it's something that they want and that they learn from, so that they can ultimately decide what they want for their future.
The Behavioral Health Collaborative is a collaboration between DSS and UCPS. So we are the social workers and the therapists that are housed in the schools to provide mental health support to the students.
So the Behavioral Health Collaborative in our community has allowed our social workers and therapists to go into the schools and work with families, with students, with the staff to make connections, make relationships, get people connected. A lot of resources that are in the community have been brought to families that wouldn't have been there before.
Starting out for interns, they are given the opportunity to sit in and observe, be able to observe a lot of our protocols, the way that we kind of handle referrals, what students are appropriate for school-based services. So the first part of their internship is kind of observation, and then the second half of it would be hands-on, where they're working directly with students and families in the schools.
So the 2-semester commitment will allow the intern to be able to really learn and immerse themselves in our experience and in our program, and then apply in the second semester what they're learning from the first semester in terms of observations.
So I was actually one of the first interns, and I absolutely loved my internship. Practicum was the first internship, and that's where we spend most of the time observing others. Towards the end, I did have to see students to meet my program requirements, but they had me shadow a social worker in the beginning, and that for me was a really great learning experience because I got to learn program basics, I got to learn the importance of how to interact with these schools, I got to attend a student support meeting, which with student support meetings, we sit around a table like this. It's the school counselors, the therapist, the social worker, the assistant principals, the school nurse. And so everybody comes together and we collaborate.
I recently had an intern, and she had a great relationship with our students in an elementary setting. And so those connections, students are still asking about her to this day. She built a great rapport with them. They had connection and they were able to confide in her, and she provided support. A lot of times people think that you can really learn our work, but it's really a passion. It's something that I feel like is within you. And so when you are doing this work and being able to mentor and guide them, you see the growth, you see the success, and you see what the community will receive by the support of that new social worker.
If you have a heart and a passion for kids, absolutely consider it. It's hard work, it is demanding, but it is so rewarding.